Welcome back to MedMind. A prodrug is A. The prototype member of a class of drugs. B. The oldest member of a class of drugs. C. An inactive drug that is transformed in the body to an active metabolite. D. A drug that is stored in body tissues and is then gradually released in the circulation. Correct answer, C. An inactive drug that is transformed in the body to an active metabolite. Which of the following cytochrome P450 isoenzymes is involved in the metabolism of the largest number of drugs in human beings and has been implicated in some dangerous drug interactions? A. CYP3A4. B. CYP2C9. C.
CYP2E1.
D. CYP1A2. Correct answer, A. CYP3A4. The following is not true of the cytochrome P450 isoenzyme CYP2D6. A. It generates the hepatotoxic metabolite N-acetylbenzoquinone imine from paracetamol. B. It is involved in the demethylation of codeine into morphine. C. Its altered form is responsible for poor capacity to hydroxylate many drugs, including metoprolol. D. It is inhibited by quinidine. Correct answer, A. It generates the hepatotoxic metabolite N-acetylbenzoquinone imine from paracetamol. The most commonly occurring conjugation reaction for drugs and their metabolites is A. Glucuronidation. B. Acetylation. C. Methylation. D. Glutathione conjugation. Correct answer, A. Glucuronidation. Microsomal enzyme induction can be a cause of A. Tolerance. B. Physical dependence. C. Psychological dependence. D. Idiosyncrasy. Correct answer, A. Tolerance. The following drug metabolizing reaction is entirely non-microsomal. A. Glucuronide conjugation. B. Acetylation. C. Oxidation. D. Reduction. Correct answer, B. Acetylation. Which of the following types of drug metabolizing enzymes are inducible? A. Microsomal enzymes. B. Non-microsomal enzymes. C. Both microsomal and non-microsomal enzymes. D. Mitochondrial enzymes. Correct answer, A. Microsomal enzymes. Induction of drug metabolizing enzymes involves A. A conformational change in the enzyme protein to favor the binding of substrate molecules. B. Expression of enzyme molecules on the surface of hepatocytes. C. Enhanced transport of substrate molecules into hepatocytes. D. Increased synthesis of enzyme protein. Correct answer, D. Increased synthesis of enzyme protein. Select the drug that undergoes extensive first-pass metabolism in the liver. A. Phenobarbital. B. Propranolol. C. Phenylbutazone. D. Theophylline. Correct answer, B. Propranolol. Drugs which undergo a high degree of first-pass metabolism in the liver. A. Have low oral bioavailability. B. Are excreted primarily in bile. C. Are contraindicated in liver disease. D. Exhibit zero-order kinetics of elimination. Correct answer, A. Have low oral bioavailability. Glomerular filtration of a drug is affected by its a. Lipid solubility, b. Plasma protein binding, c. Degree of ionization, d. Rate of tubular secretion. Correct answer, b. Plasma protein binding. If a drug undergoes net tubular secretion, its renal clearance will be a. More than the glomerular filtration rate, b. Equal to the glomerular filtration rate, c. Less than the glomerular filtration rate, d. Equal to the rate of urine formation. Correct answer, a. More than the glomerular filtration rate. The plasma half-life of penicillin G is longer in the newborn because their a. Plasma protein level is low, b. Drug metabolizing enzymes are immature, c. Glomerular filtration rate is low, d. Tubular transport mechanisms are not well developed. Correct answer, d. Tubular transport mechanisms are not well developed. If a drug is excreted in urine at the rate of 10 mg per hour at a steady-state plasma concentration of 5 mg per liter, then its renal clearance is
A. 0.5 liter per hour, B. 2 liter per hour, C. 5 liter per hour, or D. 20 liter per hour.
correct answer, b.
2 liter per hour.
Which of the following is not a primary/fundamental, but a derived pharmacokinetic parameter? A. Bioavailability, b. Volume of distribution, c. Clearance, d. Plasma half-life. Correct answer, d. Plasma half-life. If a drug is eliminated by first-order kinetics, a constant amount of the drug will be eliminated per unit time, b. Its clearance value will remain constant, c. Its elimination half-life will increase with dose, d. It will be completely eliminated from the body in 2 half-life periods. Correct answer, b. Its clearance value will remain constant. If a drug has a constant bioavailability and first-order elimination, its maintenance dose rate will be directly proportional to its a. Volume of distribution, b. Plasma protein binding, c. Lipid solubility, d. Total body clearance. Correct answer, d. Total body clearance. If the clearance of a drug remains constant, doubling the dose rate will increase the steady-state plasma drug concentration by a factor of A. 3, B. 2,
C. 1.5 or D. 1.3.
Correct answer, B. 2. When the same dose of a drug is repeated at half-life intervals, the steady-state, plateau, plasma drug concentration is reached after A. 2 to 3 half-lives, B. 4 to 5 half-lives, C. 6 to 7 half-lives, D. 8 to 10 half-lives. Correct answer, B. 4 to 5 half-lives. The loading dose of a drug is governed by its A. Renal clearance, B. Plasma half-life, C. Volume of distribution, D. Elimination rate constant. Correct answer, C. Volume of distribution. Monitoring of blood levels of diuretic drugs is not practiced because A. No sensitive methods for measuring blood levels of diuretics are available. B. It is easier to measure the effect of these drugs. C. Response to diuretics is not related to their blood levels. D. Diuretics need activation in the body. Correct answer, B. It is easier to measure the effect of these drugs. Monitoring plasma drug concentration is useful while using A. Antihypertensive drugs, B. Levodopa, C. Lithium carbonate, D. MAO inhibitors. Correct answer, C. Lithium carbonate. Sustained/controlled release oral dosage form is appropriate for the following type of drug: A. An anti-arthritic with a plasma half-life of 24 hours. B. A sleep-inducing hypnotic with a plasma half-life of 2 hours. C. An antihypertensive with a plasma half-life of 3 hours. D. An analgesic with a plasma half-life of 6 hours used for relief of casual headache. Correct answer, C. An antihypertensive with a plasma half-life of 3 hours. Microsomal enzyme induction has one of the following features: A. Takes about 1 week to develop. B. Results in increased affinity of the enzyme for the substrate. C. It is irreversible. D. Can be used to treat acute drug poisonings. Correct answer, A. Takes about 1 week to develop. Which of the following drugs acts by inhibiting an enzyme in the body? A. Atropine. B. Allopurinol. C. Levodopa. D. Metoclopramide. Correct answer, B. Allopurinol. Comment down your doubts if you have any, and also don't forget to comment your final scores. So, that's all from this quiz, but you can continue learning by watching our next video.